Welcome to the show. I'm Dr. Ronald Yap. Now that the weather's getting nice around here and everyone's headed outdoors, people are hiking, biking, hunting, and fishing. And as they're going out and doing those activities, there is a hidden danger that lurks amongst all the flora and fauna. I'm talking about ticks. So once considered a nuisance, these guys can cause some serious health problems nowadays. Jim Noble from Concord Hospital joins me today to help educate us on this emerging health risk. A few words on Dr. Noble. He went to medical school at the State University of New York. He completed his residency at the Cornell Cooperating Hospitals and then went on to infectious diseases training at Tufts New England Medical Center. He's board certified in internal medicine and infectious disease. He's been on staff at the hospital since 2001 and currently serves as the medical director for infection prevention and also is the section chief for infectious disease at Concord Hospital. So welcome to the show, Jim.
Thanks, Ron. Good to be here.
Yeah, thanks for joining us. Now, you've been on staff now for, let's see, 16 years now.
That's right.
Tell me about your journey to Concord and how you've seen, the landscape change over time.
Absolutely. Well, how I got here is sort of a long story, but my grandparents started bringing me to central New Hampshire when I was really a newborn. I came here every summer with my grandparents and with my parents and my sisters, and eventually with my kids. And I've been trying to live here. I tell people as soon as I realized that this place was different than Brooklyn, I've been trying to live here. But seriously, there was never an opportunity that presented itself until 2001. Concord Hospital ran an ad in one of our professional journals, and I responded, and the rest is history.
Yeah, that's the funniest thing, because people ask too how I got here, and because it's a booming group, and we've all had a lot of success here at this institution. And same thing. There wasn't any special in for me or calling up anybody. I just had a job ad that I answered. Yeah. It sounds kind of antiquated nowadays in the age of electronic stuff. And
well, it's true. I mean, people are bugging me all the time, as I'm sure they are you as well, about jobs, and that kind of stuff didn't really exist when I came here.
Sometimes it's just dumb luck, right? Dumb luck. Well, I'm glad you're here with us today, and especially in New Hampshire, we have one of the highest infection rates in the nation.
Absolutely.
And I heard per capita the highest in the nation just based on our population and the number of ticks and everything. Like I mentioned, we're talking about tick-borne illnesses, but nowadays that's not just one thing, and everyone knows Lyme, but can you give me an overview? What are we talking about in 2017?
Sure. Well, there's four main tick-borne illnesses that occur in New Hampshire and in the surrounding areas. One is Lyme, which, as you say, everybody's heard of. People know a lot of things about it. There's still undiscovered parts to that Lyme story. But the other three big ones are Anaplasmosis, which is caused by a type of bacteria, Babesiosis, which is caused by a parasite, and then what people are calling POW, a viral type of encephalitis that's also spread by ticks. So the ticks here really cover the spectrum of bacterial disease, viral disease, and parasitic disease. It's really striking to me that we've seen so much anaplasmosis in the last couple of weeks. It's just at the hospital, we've had 6 or 7 people sick enough to be admitted.
Wow.
It's really an up-and-coming disease, and we don't know yet, probably won't know till the end of the summer, whether that's because more ticks are infected, that is, the percentage of the tick population that's infected has gone up, or the bug has changed in some way. We'll find out soon, but we don't know yet.
Yeah. And essentially, although they're separate diseases, we're essentially talking about a disease that you get from a tick. Can you explain a little bit how that process happens? Because it sounds like they're pretty much unified in the sense you get it from getting
That's right.
bitten by
getting
a tick.
Getting bitten by a tick and the tick attaching itself to you.
Okay.
We know that in the case of Lyme disease, the tick has to be attached for a while, probably at least 36 hours, in order to be able to transmit Lyme disease. The Lyme disease germ itself is big for a germ. So that may have something to do with the duration of attachment that's necessary to transmit it. The others, though, can be transmitted in much less time, it appears. Maybe as little as a couple of hours. But a tick that you brush off doesn't represent a hazard of disease transmission. And that's why we ask people when they come in from hiking, they come in from the woods, they come in from playing with their animals, that they do check for ticks. That's an important safety step at this time of year.
So just because it's on you doesn't mean it really has to latch on.
That's right.
And start feeding in
because
some way.
Actually it's the connection between the tick and your blood system that causes the spread of the disease.
I see. Now, since we're talking about multiple diseases, there are also multiple species of ticks.
That's right.
Are there particular species that are associated with a particular type of disease?
Well, the main hazard in New Hampshire is the so-called black-legged tick or deer tick that transmits all 4 of these diseases.
Okay.
The dog tick or wood tick can transmit some less common bacterial diseases, but really we see those once or twice in a 5-year period. So that's not really that big of a deal.
Got it.
It's really the deer tick that we're focused on, and the juvenile or nymphal stage of the deer tick that's the biggest problem. A, because it's tiny and it's hard to see, and B, because until it gets engorged, the nymphal tick, the baby tick, acquires the infection from its parents.
I see.
And they multiply to a very high level in that small developing organism. That's one of the reasons that.
So you're digging deep because in medical school we were all exposed to epidemiology or the study of disease and how things transfer. So you're saying that just as a baby inherited from the parents, they can harbor disease.
That's right.
And I was taught when we were doing our epidemiology, public health type stuff, that there's also that whole idea of animals that it bites to also acquire the infection.
That's true. So the deer is the intermediate host for a lot of these diseases in our area.
I see. So interesting. So the tick can have it from birth, or it can bite an animal.
That's right. From the blood of the animal.
And get that from the blood of the animal.
Yep.
And it's interesting. I have a dog, and I recently vaccinated the dog for Lyme because I had heard that the dog's common household dog could also be a reservoir too.
We don't know whether dogs' blood, ticks feeding on infected dogs, acquire the disease that way. And dogs, the main hazard that dogs I have to represent to people is not as a vector for them having Lyme disease, but as a vector for ticks, bringing ticks into the house.
I got it.
We've just started to recommend, actually, that people get those lint rollers that you use on your clothes, and when your animal comes in, you do it on the animal, and it picks off an amazing number of these little ticks that have, they can jump off and jump onto you.
Got it.
That's the big thing with dogs and cats.
We don't want to be a vet show, so we take care of people.
Yeah.
But since we all live with animals, sure. If it's out in the woods running around, and even if it's got some there's a lot of really good anti-tick medications, parasitic medications.
Absolutely, yes.
And like I said, we'll stay human. But just because you're on that stuff doesn't mean that something can just hop on.
Right.
You walk in, it hops off, and all of a sudden it's on you.
That's right.
So if you now, since we talked about a couple of them, I think it's prudent nowadays, since we're not just talking Lyme, we can do a few minutes actually on each one.
Sure.
And I guess we'll start off with the big one. So I guess you get bitten by a tick. How do you know? Although it's hard to tell sometimes, how do you know that you got it? And what happens next?
You mean Lyme?
Lyme, yes.
Yeah. Well, Lyme disease is a great imitator. It can mimic many different diseases. The usual way Lyme disease presents to us is one of 2 ways. One is the development of the characteristic rash, which is a so-called bullseye rash, meaning at the point of the tick bite, the skin clears, and then there's a sort of ring that expands on the skin. That's a bullseye rash. The scientific name is erythema migrans, and that's sort of the classic lesion of early Lyme disease. A lot of people, though, with Lyme disease don't ever get that rash or don't ever see it. And in the secondary stage of Lyme disease, people can become quite sick with fever and muscle aches and look as if they're septic. And it's very important when people get admitted to the hospital for suspected infection that way that they get tested for Lyme disease nowadays, which we do in almost all cases.
Yeah, and I think the testing's gotten so much better. And
That's
I
right.
think we mentioned just before the show that we know about these diseases more, the other ones that aren't Lyme, because there's better testing.
Right.
And people that just had fevers, we would say, we don't know what's wrong with you. You just,
We've been really fortunate that in the last 3 or 4 years, we have the ability to test human blood for the DNA of these germs. So we can actually find the genetic traces of the germs in the bloodstream. And that really, A, makes a very specific diagnosis, and B, helps to rule out other things.
I see. So when someone has the rash or starts developing symptoms, and let's say that you've been confirmed as having it, either clinically or by testing, what does the doctor do then to treat a patient with that disease?
Well, with Lyme disease, people typically are treated with doxycycline unless they have evidence of neurologic involvement. Lyme disease is really a 3-phase disease. There's an early stage, which is mostly in the skin. There's a secondary stage, which is systemic. And then there's a 3rd stage, which can involve the heart, can involve the brain, and typically will present sometimes with a facial droop, sometimes with an abnormal heart rhythm and a sense of palpitations, an abnormal cardiogram. Patients in the late stage or patients with cardiac or neurologic disease, we typically will treat with IV antibiotics,
I see.
not with doxycycline. Although among people who specialize in this field, there is emerging a feeling that perhaps doxycycline is a better alternative
Got it.
to the IV.
And it sounds like the earlier you get it, preferably at that rash stage, the more chance you have of, nipping it in the bud, so to speak.
That's right. We treat people longer who have the more advanced stages of Lyme disease. And people who have early Lyme disease cured don't typically have persisting symptoms. About 7% of people who get treated with antibiotics for Lyme disease will continue to feel poorly after the treatment. And what that's all about is a subject of a lot of research and a lot of interest.
Sure. And we won't go into that part. I think that, the whole issue of chronic Lyme is a sticky wicket.
Yep.
We'll just talk about, for the, the public at large, what to look out for and kind of the more common things. How about prophylaxis then? So let's say someone just got bit and
Yep.
you have somebody with about that time frame, so about 36-ish hours,
Yep.
the tick's engorged, but you don't see anything. Is there any role for prophylaxis or
Absolutely,
prevention?
yes. There's a recommendation which is offered with a number of caveats by CDC, but to give a single dose of 200 milligrams of doxycycline. And we do that fairly routinely when people are pretty clear that they've had a tick attached for some amount of time.
Got it, with the story.
We typically won't do it for people who have brushed off
Yeah.
a tick or who took a tick off their dog.
Got it. And, in our state, this is huge. So we had recently received a bulletin from the New Hampshire Department of Health and Human
Yes.
Services here that it surprised me that 50 to 60% of ticks in New Hampshire have, harbor Lyme
That's
bacteria.
right. And as I said, we've seen an extraordinary increase this spring in this disease called Anaplasmosis, which is a bacterial disease that infects white blood cells. We've seen, our practice, we've seen 7 or 8 people sick enough to be admitted to the hospital,
Wow.
more than half to the intensive care unit.
I see.
And it's unclear to us at the moment whether that reflects a great increase in infections and ticks or some other factor. We just don't know.
Yeah. It's kind of like the chicken or the egg, because the season, in New Hampshire, we had kind of a mild-ish, winter.
That's right.
But it's also very wet.
Yeah.
And now it's like almost like a swamp out there until recently. So there's a lot of, ticks flying around now.
I think
hanging out.
tick ecology is really a complicated subject. We know that Lyme started on the Cape and the islands. It's named after a city in Connecticut where the first cases were recognized, and has moved north year after year after year after year. Mild winters do seem to favor increases in the tick population and increased propagation of tick-borne diseases. And as you know, is not to stray into veterinary medicine, but has been terrible for the moose population in New Hampshire.
Oh, I heard that. Yeah,
I don't know why they're so hospitable to ticks, but you find them fall over dead in the woods with hundreds of ticks on them. It's a terrible, sad thing.
Yeah, and I heard like these guys can hold. I don't know if this is a wives' tale, but even like somewhere in the world, 250,000 ticks just hanging off of some of these poor animals.
I know, it's terrible.
And but that's how you get these diseases. Just the exposure, the reservoir, and access to humans. Now, so we talked about Lyme, we talked about anaplasmosis. How about babesiosis? That's on the list too.
Babesiosis is a disease. It's a parasite, not a virus or a bacterium, that infects red blood cells. It is very similar to malaria, which most people have heard of.
Yeah.
Some people even give it the eponym of New England malaria. It can cause all the things that we see with malaria: breaking up of red blood cells, injury to the liver, enlargement of the spleen. People who have spleens damaged or removed can get very, very severe babesiosis, can even die from it, although that's less common in people who have their spleen intact. Babesiosis has been harder to diagnose, A, because people often don't think of it, and B, because the ability to diagnose it microscopically is less than it used to be, let's put it that way. Doctors like you and I were trained to identify these intra-red blood cell parasites using conventional microscopy, but now really people fall back more on DNA testing, and you got to order it to get a result.
I see.
Anybody in our area who's had fever for more than a couple of weeks, who's got a low red blood count, and who's just been feeling poorly, that's in the differential and something we want to test for.
Got it, got it. And these tests, are they internal to Concord Hospital, or are they send outs to the state?
We send the DNA testing out to a lab in Salt Lake City. Actually,
Oh,
the
okay.
state doesn't do the DNA testing.
I see. Interesting. And what's the turnaround time for these types of tests? They seem pretty exotic.
We can get them within a day or two, but it depends a little bit on when we send them.
I see.
I know they do anaplasma and babesia 3 days a week, Monday, Wednesday, Friday. So
Got it.
you could imagine sending it on a Friday night and it arriving on a Monday morning and not getting in the queue, not being done till Wednesday. We clearly would like to explore bringing some of this in-house because of the nature of
this is
population.
this is a hotbed exactly for it, and it sounds like, you know, as you know, we don't just rely on testing. I mean, you know, as doctors, if it looks like a duck and it quacks like a duck, it could be a duck. So it sounds like if you see people with these constellation of symptoms, you don't hesitate to treat these people.
Oh, absolutely right.
Pending.
And in fact, you know, I just got from the lab, you could see both Babesia and Anaplasma under a microscope. And an astute laboratory technician on a Saturday of last weekend sent me a photograph of a white blood cell of a patient that showed Anaplasma inside the white blood cell. In that case, we didn't have to wait for the molecular testing to come back.
Well, that's great. That's great because that's old school.
That's right.
That's like you're going Leeuwenhoek on me, huh? You know. So the last one on the list is what's it called? The Powassan.
Powassan virus encephalitis. And
this is brand new.
Yeah, it's brand new. And unlike these other diseases, there's no preventative vaccine and there's no antibiotic treatment for it. So the key to preventing Powassan encephalitis is to avoid tick exposure to the greatest extent possible.
I see.
And there's a number of important recommendations about how to do that. One, we've talked about already, checking yourself and checking your pets when you go out in the woods. If you're going to be hiking or walking in a tick-infested area, DEET is an effective tick repellent as well as mosquito repellent. And for some reason, lighter colored clothing seems to be less attractive to ticks than blue jeans are.
Interesting.
And so actually we recommend that you can get online or at one of the local merchants clothing that's impregnated with repellent. And it's really the lighter weight and lighter colored stuff that seems to be less attractive to ticks.
Got it. So you really want to just stay away because this new one, what's called the Powassan?
Powassan, POW, people call it.
POW, gosh. And it sounds like there's no treatment, and it sounds like neurologically, mainly the symptoms?
It can cause severe neurologic symptoms which can persist.
I see.
So fortunately, it's much less common at the moment than these other diseases are.
I got it. And it sounds like the best medical supportive care you can.
Yes, that's exactly right.
Fluids, hydration, just ride it out. And it's similar to almost like a viral meningitis.
Yep,
I mean,
that's
some
exactly
people
right.
have meningitis and it's a virus, you can't really treat it, but you ride through it and,
Yep.
you know.
The difference is that this is a meningoencephalitis, so it affects the brain as well as the lining of the brain, which is why it's so dangerous.
Both ends. So you've highlighted my weakness as a urologist because I only work from, I tell patients I only, you know, the other colleagues, I only work from the waist down. So you want like, you know, super tentorial, we say in medicine, you know, you went above the, you went over the, you know, out into the neurologic system for me. So yeah, a couple words before we wrap it up, just about that prevention, because I think if one were to watch the show, I don't know, it may scare the bejesus out of people to go outside.
Well, no.
But I think the key is that we're a very outdoor state, and we want people to have fun outside, and this is why people live in New Hampshire. I think a lot of what attracts us all here is that we got the 4-season living, and now's the time to like live it up and enjoy it with all this outdoor stuff. And I think you've highlighted a couple of, you know, interesting, you know, ways to prevent it. But, you know, just to recap, it sounds like, you know, chemical repellents and also lighter clothing and just keeping a barrier away.
Yep.
I heard some stuff also, but just tucking in pants, legs, and
yes, of course. If you
of
wear
barrier.
long pants when you're hiking out in wooded areas, or tall grass, which really you should, tucking pant legs into your socks and using DEET repellent down there can be very effective at getting these guys off.
I got it.
But again, I think you can't overstate the importance of, and in fact, it can be fun in some circumstances to do that tick check.
I got it. So that's the key.
I don't want to get too explicit, but
so it sounds like number one, yeah, just don't have them get on you.
Right.
And then if you look very closely and do, you know, really frequent tick checks when you're out, you can prevent it. Now, how about spraying? I guess residential, there are more people that are spraying now because people are scared of mosquitoes. That's a whole nother show.
Right.
You know, 'cause I'm getting the wrap it up soon lights.
Okay.
But we could bring you back, and there's a whole mosquito-borne thing now. And is spraying effective somewhat for like residential or other areas too?
Spraying can be very effective. Spraying is also very controversial.
Is that right?
Yes, because of the potential ecologic impact. I think that when bad mosquito-borne diseases are identified in an area, the most recent example, although fortunately not in New Hampshire, has been the occurrence of Zika virus in Florida and in Louisiana. There are people who are very anxious, people who are very assertive about the state health departments beginning spraying. There are also people who are very opposed to it and don't want it to happen.
I see.
So it's not really a straightforward medical issue.
Got it. And the other thing too is that, you know, we're talking about arachnids here. I mean, a tick is arachnids, and
right.
they're more hardy than a mosquito.
That's
Like
right.
a little whiff of anything is going to kill a mosquito or get rid of it, but we're
That's
talking
right.
about a bit more hardy.
That's right, which is why we like people to use this stuff on their clothing.
Got it.
To help keep them off.
Got it. Awesome. Well, thanks for joining me today.
Oh,
I mean,
my
we
pleasure.
could we're
Glad
just
to
like
be
we're just
here.
like jamming here. I mean, we could go, you know, we should just break out some beers and we could go all, we could do a marathon, but we'll your expertise is highly valued, and we'll get you back on the show again, because this is a hot button topic. You may find that you may go through waves probably where randomly all of a sudden
Yeah, we absolutely do.
There's an Ebola outbreak. We got to get Jim Noble on, or there's a Zika outbreak. We got to get Jim Noble on. So
Yeah, we do. We envision ourselves sort of like living in a firehouse, you know. Sometimes the alarm goes off, you go down the pole, and there's a week's worth of work there.
wonderful. Well, it's great to have you communicate, you know, very effectively to the public these important matters. And like I said, we'll get you back on, you know.
Thank you.
I'll see you. Thank
Glad
you
to
so
be
much.
here.